Okay, hi. I'm having technical difficulties. Hi, welcome to Mad Medicine with Miss P. Today I figured I was just going to do a couple more care plans just to kind of seal the deal because I know they're tricky. And then my pet peeve is actually the illustration. So I drew it and then I'm going to try to get it in focus. I don't know. We'll see. Anyway, just a couple little quick care plans because I know they're tricky. So obviously this is kind of geared more towards students. I'm sure the nurses in skilled facilities need this also, but for the most part, I want to just kind of give you some basics. And these are generic. Obviously you would fine tune all of your care plans for your patients, but for right now, since we did, I think we did the skin integrity and gas exchange, and I think like even nutritional greater than and less than body requirements. I think we may have touched on both of those. So today I figured we'd do chronic confusion. So last week I kind of started to talk about how I always do a hierarchy. So I start with either chronic confusion or verbal communication. And so if I can't figure out what nursing Nanda to go with, I'll sort of think like, okay, real basic. If there was a fire, if this patient was having chest pain, could they verbally tell me or could they be alert or aware enough to even know they're having those things? So I kind of start with verbal communication, chronic confusion, and then I'll go to mobility. If there was a fire, could they get out? Would they recognize there's a fire? Could they tell me there's a fire? And could they get out? So then I go to mobility. Then I'll go to anything obvious, or may even start with that obviousness, skin integrity, or airway if they have a trach that's clogged or suctioning it, that sort of thing. So if I can't figure out what it is, then I'll go to the verbal communication, chronic confusion, mobility, and work from there. So I figure we'll do a couple of those. So with chronic confusion, obviously your NAND is going to be probably something like chronic confusion related to chronic degenerative or just degenerative brain disorder affecting memory, cognition, reasoning, and thought process, or whatever you need to do to kind of describe what's going on with your patient, as evidenced by patient is oriented to person only. So then I'm going to think of a realistic goal to work towards. I'm not going to get them completely oriented in the 5 days I'm working with them, or the 3 days that the students have on the floor, or 2 days, or even a couple weeks if I'm on a long-term care facility. So I'm going to get realistic and say something like, I would like this patient to be able to, let's say, state the season. Maybe we can't get to the date. That might be too tricky, but maybe they can remember that it's springtime or that it's summer or fall or whatever it is. So the goal would be, a short-term goal would be, patient will state the season, or if you can do the date, if you can get them to say their location, maybe that they can remember what city they're in, whatever it is, be specific. So it has to be measurable, realistic, specific, and dated. Your goal has to be measurable, realistic, specific, and dated. So if I want my patient to state the city they're in by this date, 3 or 4 days, of consistently running it through them, maybe they can, regurgitate it back. So your care plan is going to start with the most obvious things. So anytime you're dealing with someone with chronic confusion, you're going to maintain eye contact when speaking with them with each interaction. You would introduce yourself and call them by name with each interaction. That's just kind of increasing their orientation, decreasing their confusion, hopefully. You might get a calendar with large print that has, seasons in the picture, near their bed where they can see it clearly. I might write on a whiteboard the season and maybe even draw a picture. Some of you are wildly artistic. Find some tech that is just crazy gifted and draw a tree with leaves falling, if it's autumn, whatever you want to do. But do those things that will remind her on a regular basis, and you can kind of point to them and gesture and try to get her to recognize it on her own without you constantly having to say so. And then every time I come in, I might say, isn't it a beautiful fall day? And then later within that same interaction, I might say, do you remember what season it is? Or can you tell me what season it is? Or open the window. And if you live in a place where there's actual seasons, I'm from South Florida, we had no seasons. It was hot, super hot, crazy hot, and oh my God, I'm gonna die. So those were our 4 seasons. But I live now in a place where we actually have seasons, and you could open the door and see, or the window and see, pink trees and orange leaves, and it's crazy. It's so crazy beautiful that I would open her window or her blinds so she could look out and see what season it is. So those are real simple things that you can do. And I know you all want to get on nursey and deep thinking with like bizarre, generic if, use that book that always says, if the patient is this. This is a live patient. It's your real actual patient. So if you know her well enough, you can do things that are specific. You can write in interventions that are specific with this patient. So if her daughter comes to visit every afternoon, then you can also have her daughter participate. And in that intervention, you can say, encourage daughter to question patient on the season. And and if that patient gets it right, or if you have to consistently kind of cue them on what it is, you want to add some encouragement in there. And if she guesses right and she's got a shot of 4, if she happens to guess right, really reward her and praise her. Patients like that. I don't care if you're 6 or 60. Patients like that. So like I said before, they like the gold stars. They like being told good job. So do what you have to do to make sure that they are encouraged to want to participate with you. So and then of course your evaluations would be, did the patient state the season? After encouraging the patient repeatedly to state the season, your evaluation is, did she state the season? Not so much, you all want to write in there like what you did. It's not about you, it's about the patient. So don't bother writing in there and I love when y'all have I's. There's never I's in nursing. There's staff or the nurse stated. There's never I's. We don't ever discuss first person. It just doesn't read across correctly. Hopefully you'll never have to do it, but in court you'll see what I mean. So the way it's described is, you might say something like, after repeatedly stating the season to the patient and then asking her to state it back, patient was unable to state the season. That's your evaluation. You don't necessarily have to write in there everything that you did. And I know some instructors want that. They want you to write in there like how many times you did it. Well, that's fine, but that's kind of like an evaluation of you and your progress or your work that you put into it. It's not about you. It's about the patient. So evaluate what result you got after all your hard work. Okay, so the other one I would do is verbal communication. So let's say your patient wasn't able to really, she had dysphagia, like she was mentally there for the most part, but just couldn't get the words out. We had a sweet little guy like this. He had Parkinson's so bad that he could get his name out, and then sometimes he could speak freely, and then other times he just stuttered and stared at you, and it was not working. But anything you can do to encourage that, right? So depending on what the issue is, let's say they had a stroke or Parkinson's or whatever it is, you would describe that and you're related to, right? So impaired verbal communication related to a degenerative neuromuscular disease affecting fine motor and even large motor skills with difficulty expressing words and using oral capabilities or however you want to say it. You basically kind of look up what Parkinson's is, or if they had a stroke, I might say, and I think I said this last week, related to a previous episode of loss of blood flow to a portion of the brain affecting the speech center, as evidenced by patient has slurred, garbled, and delayed speech, very difficult to understand at times, period. Then your goal, patient will clearly state his first and last name. Let's just go real basic. So just concentrate on something he's probably said 1,000,000 times in his life. Let's see if we can at least work on those skills. Are we going to get there? Maybe not. Is it so degenerative that it's not going to happen? It might not. But can we try and give it all we've got? Are we going to spend hours and hours on it? No. That every time you go in there, you can encourage the patient to state their first and last name clearly. Same thing here. Anytime they say so or attempt, give it a good, hard attempt, you reward them and you praise them. And you do what you can to get them to do that correctly. So every time you go in there, I would encourage them to say their first and last name. And I would also encourage them to say yes and no. Don't let them shake their head yes and no. You want to get these muscles and this control from the brain to the mouth back in order here. And some of them, if this is a 62-year-old man that had a stroke, he may get all his faculties back. It's entirely possible to get all of that muscle and nerve control back. It's happened. My grandmother had what they said was a TIA, but she had symptoms for like a week, and I thought, oh my gosh, this is it. She's going to be paralyzed. And then it all came right back. It was crazy. So it doesn't mean it can't. So always act as if there's a capability of getting it better, and also set reasonable goals. So if you have a patient with impaired bed mobility, right, because we talked about mobility before, you always start with bed. Can they move themselves in bed? Then you're going to go to physical mobility. Can they maybe sit up on the side of the bed without help? That's physical mobility. Then can they transfer? That's impaired transfer ability, if they need help transferring. Then you have wheelchair ability. Once they get in the wheelchair, maybe they can transfer to it, but once they're there, they don't have the strength or the ability to, wheel themselves. Then you have impaired walking. So you can't get to impaired walking if they can't even move themselves in bed. So take baby steps. Impaired bed mobility, physical mobility, transferability, wheelchair, walking, in that order, right? So if this person can't turn themselves in bed or reposition themselves, stop jumping to transfer. We're not talking about transferring. We're just talking about moving themselves in bed. Patient will assist turning to the left side. Let's say the right arm is their stronger arm. Patient will assist in turning to the right side by grabbing the side rail. That's your goal. That's a real simple, real basic, hopefully achievable goal. Okay, is it 100%? Are they maybe going to have difficulty with it? Maybe. But at least you could try to set something that is the most basic, the simplest, and see how far you get. And then if they're like, oh yeah, I can do that. And listen, I've seen these students in there getting these patients to do things that I can't believe they can get them to do. And I think I even told you, I've told students in the past, I had this one little student nurse, loved her to death. She was just the happiest, sweetest little girl, always in a good mood, always tried hard, loved her. She went in there and got this patient who I thought rigor mortis has set in. Like, I've never seen him bend his knee or move his arms. He literally just lied there on his back forever. Surely they've repositioned him because he never really had any wounds, but he was just as stiff as a board. And after her being in there, just all over him 3 days straight, she got him to turn himself to his side. So much so that B-Bed was like, I can't believe you got him to do that. Like, that's how surprised everybody was, including me. Totally. Don't think it can't happen. And I know you've seen these elderly patients in fetal position, non-responsive, and after I put a student in there that's all over them and giving them care and talking to them, they just come alive and suddenly they're a different person. So set a realistic goal that's measurable and specific so you can decide whether they made it or not, that's dated. But be realistic in this case. So if you just want him to say his first and last name, then do things to encourage verbal communication. Like, if you know he really wants some ice cream, then bring in some ice cream and say, you need to say chocolate and I will give you this ice cream. Is it a bribe? Yeah, maybe a little bit, but will it work? Probably. So see if you can't encourage this patient to use verbal communications. A lot of times what you guys do, you'll say like, use flashcards, and that's okay to meet needs. I understand that. Or use a dry erase board, so they can write things down, and that's okay so they can meet the needs. But none of that is going to improve their verbal communication. So think of things you can do to improve verbal communication. And then again, your evaluation is going to be, did they say it? Did they say it clearly? Did they attempt? Did they try? What was the result verbally after you tried this intervention? And then the last one I figured we'd talk about today was the bed mobility. So if we did, let's say, patient will, using the strong right arm, pull himself to his left side during repositioning and, changing or cleaning or, whatever it is. So, just don't write a book, but verbalize it to where it makes sense, or, or word it to where it makes sense. So then what 5 things can you do to get this guy to want to and accomplish pulling himself over to his right side? Well, first, real basic, if you're going to be in there working him and making him do it, then that's number 1, right? Encourage patient to use that right arm as often as possible during changing and repositioning, right? Practice makes perfect. Number 2, give him or encourage increased protein intake, because if you're going to be in there making him work more than just a couple techs going in there and just doing it themselves, because I get it, it's fast, you got 1,000 things to do, you want them done, you want it correctly, do you have time to be in there and be their therapist? Maybe not. But as a nurse, we need to try to improve their quality of life, and that is improving their motor skills, in this case especially. So encourage him to do it as often as possible, and then give him some protein to be able to get that done. Can you run down to PT and get like a little squeezy ball that he can do maybe 10 times every hour to try to increase that muscle tone so he can grab it and pull himself over? Probably. Reward, as always, reward him and praise him for anything he does and encourage him to do it, with these rewards. And, you want him to do it, so see if you can get him to do it. And then you can also get your 5th intervention could be to go down and get some sort of resistant elastic band that he could, maybe hook to the end of the bed or his foot and pull on that arm and try to make it stronger also. Assuming, let's say, he's like paralyzed on one side, we're going to increase that right side. Otherwise, we do a little of both. So those 5 simple things may encourage him to be able to roll over and use that side rail to hold himself up, or to grab the side rail to pull himself over while you guys do, your job. So It's real simple. Don't overthink it. Don't make it harder than it is. I know y'all love to do that. It's really not that difficult. You find the problem after working with this patient consistently and figure out 5 simple things you can do to make them better, to meet your goal, which means your goal has to be specific so you know what you're working towards, realistic so your heart's not broken, and then it has to be dated. So it has to be measurable and dated. So you have to be able, you can't say, patient, you guys all do this, good God, if I had a penny for every time I saw this. Patient will increase or maintain. Not a lot of things we want to maintain, but patient will maintain or increase optimum cognitive level or ability. I don't know what that is. You don't know what that is, so quit writing that stuff down. Okay, so that's it for our nursing care plans. If the 4 of you still watching this have any questions about that, you can always leave a message. Let me know, and I'll try to help you out. Meanwhile, I'm going to try to do this. Can you see it? You might. Oh, that's not too bad. Okay, I hope you can see that it's not too whitened out. But okay, so here, this is going to happen later today, as it has happened the last couple Tuesdays. Okay, so this is me pulling out of Planet Fitness, where I work out very, very hard. I don't just go for the tanning bed and the massage chair. I work out for hours on end. Then I'm gonna pull out here. Now I wanna zip across here to go to the chiropractor because I'm all sorts of jacked up, right? So the chiropractor's off here down to the end, right? So this dipstick right here is apparently going, now this is that middle lane, this is the turn lane here, this is traffic going, this way. So this poop for brains guy right here, he's apparently going to want to turn in here. Okay, right? I know you all know what I'm talking about. I know. If you're that person, don't be that person. So this moron is way back here stopping me from being able to go when I finally have a break in traffic, right? So now this dipshit is going to, I swear, this is what he does, I swear to God. He's going to, when there's a break in traffic, he's then going to pull up where he should be anyway, then eventually make this ever so slow turn, and then what happens when he makes the turn? That's right, 500 more cars are coming this way, and I have to sit there for the next idiot that pulls up and stands right here and waits for me to not be able to go again. Don't be that person. This is a huge pet peeve of mine. Like, every day. And then, as they pass me, I pray for them. I don't give them the look of death. I pray for their safety. All right. Loves ya. Hugs and kisses. See you soon. Can't wait. This isn't going to work either. I hate this stupid $6 remote. Hey, did it work? No, still not. Okay.